guys, Dr. Modesta here, and in the spirit of cervical cancer month, I'm here to tell us how to prevent cervical cancer as they say out there. Cervical cancer is the cancer of the cervix, and our cervix is located between the womb and the vagina. It's caused by a very common virus known as human papillomavirus, HPV. But not to make you panic, right? With the right measures, it can be prevented. So other causes of cervical cancer are early exposure to sexual intercourse, having multiple sexual partners, long use of oral contraceptive pills, yes, OCP, poor screening exposure to cervical cancer, immunocompromised people, and even smoking. Another thing that we usually don't talk about a lot is men needing to get vaccinated, but we'll talk about that when we get to the prevention. But under the cause, this is a factor because men can be carrier of HPV virus. Unfortunately, there are no signs at the early stage. It's asymptomatic. But then the later symptoms that we get to experience, number one is postcoital bleeding. That's bleeding after sexual intercourse. Most times when patient comes to the hospital with this particular complaint, we think of cervical cancer until proven otherwise. Secondly is intermenstrual bleeding. Thirdly, foul vaginal discharge, abdominal pain, and serious pelvic pain. So these are the symptoms that a woman would complain about or experience when we are thinking about cervical cancer. Prevention, they say, is better than cure. So what are the ways to prevent having this cervical cancer? Number one is human papillomavirus vaccine. So it's advised to get vaccinated before being sexually exposed. Secondly is regular cervical screening. So what are the methods of this cervical screening? We have two methods. We have pap smear and HPV testing. So the pap smear helps us to detect early precancerous cells around the cervix, while the HPV testing helps us to detect high-risk infection. And this can be done for men as well. Thirdly, stop smoking. Honestly, guys, smoking does no good to our body. So stop smoking, practice safe sexual intercourse, use of condom. This helps to prevent the virus from having access to the cervix. Now, HPV vaccine is readily available for both genders from age 9 to 14. So this is because it's assumed that before this age, one is not yet sexually exposed. But then, you can still get the vaccine after this age if you have been screened and found to be negative, or secondly if you're not yet sexually exposed. But then pap smear, that's the screening method, can be done from the age of 21 or the age of 25 up to age 65 years old. And you are stopping at 65 years old if all the results has been negative, but it's till age 65 it's not negative. Obviously you're supposed to start treatment.
Advanced Place Hospital, women's health is taken seriously. The hospital provides cervical cancer screening and early detection services, medical consultations and patient guidance, supportive care for women living with or recovering from cervical cancer, referrals and coordinated care with specialists when advanced treatment is required, compassionate counseling, because healing is not just physical. Early detection can save your life. This Cervical Cancer Week, encourage the women around you, mothers, sisters, friends, to get screened. Get informed and seek care early. Your health matters. Your life matters.